Hello everyone and welcome again to today's coronavirus update with Dr. Liello and myself. And so let's just get right into the questions.
Sure. So the first question I have, when we do a daily short walk through our community, we practice physical distancing. We see many service people visiting homes, renovating, repairing, fixing roofs, cleaners. We are elderly and we've had some help with the house cleaning. We're hesitant about resuming this service. If we were to do it, we would do physical distancing. We'd wash down any surfaces that the person touches within the house to be safe. We would provide her with gloves and a mask when she comes in. What would you advise? So it's a good question. I've been telling my patients that now more than ever that we're going to start to see a slow reintroduction of different industries into society. We have to be even more vigilant and even more cautious. So essentially this kind of 1 month pause that we've had on society, it hasn't made the virus go away. So the virus is still out there. Really what it's done is it's reduced the burden that could have been put on our healthcare system, the hospitals, the ICUs. So that's really the benefit of what we just did. We're not really anywhere close to herd immunity. We're still pretty far away from a vaccine. So even like now more than ever, we have to be extra cautious. So I would say no to the cleaner for now, to try your best without the cleaners and to not dwell too much on it because it doesn't look like we're getting any visitors to our homes anytime soon anyways.
That's true. And another question on cleaning.
Yeah.
Is there such a thing as over-sanitization? We're so busy disinfecting everything, aren't we weakening our immune systems? Just like when we take antibiotics. I'm thinking about when life gets back to normal, we won't be able to fight the regular microbes, including COVID-19. Okay, that is an interesting and complex question at many levels and definitely controversial. So let's start like this. The number one strategy for cleaning at any point in time is soap and water. Really, nothing beats that. And interestingly, soap was discovered 5,000 years ago. And I thought it was interesting, there's some comment there on technology and coronavirus and getting back to basics. There was something in there. But just to get back to the question, it is controversial. What the audience member is asking is about the hygiene hypothesis. So the hygiene hypothesis actually refers to early childhood, so let's say 0 to 5 years old, and exposure to certain microorganisms. Now, to clarify, that's when we're very young. It doesn't necessarily apply after the age of 5 or our age. And it applies only to certain bacteria, viruses, parasites, not all of them. So yes, there is some theories and some people that say that if you completely sterilize a child's environment between 0 to 5, they're not being exposed to certain of the basic organisms that will give them protection later in life. But these are organisms, not necessarily the common cold we're talking about here. We're talking about our microbiome, like the organisms that were built into our system thousands of years ago. Those are the ones that are important for decreasing perhaps allergies like asthma or hay fever or maybe irritable bowel disease, inflammatory bowel disease like ulcerative colitis and Crohn's. But I want to highlight again, it's still very controversial. And nobody is saying that increasing infections in childhood are a good thing. So there's definitely this fine balance like everything else we've been talking about during these videos. And just to highlight the point again, after the age of 5, the level of exposure, whether you're exposing yourself to more bacteria or not, does not affect your immunity and does not change your risk of allergies. So it's really specific bacteria at a specific point in your life. So that's all I thought. we would say.
It's a good point, and it is a bit of a slippery slope because you hear sometimes people use that hygiene hypothesis a little bit incorrectly, and it leads to unwarranted opposition to vaccines. That old adage like let your body take care of it, or what doesn't kill you makes you stronger. So it doesn't really apply to these at all. Like you were saying, it's really just early childhood exposure.
Wow, what a great point. That's so important.
Yeah.
And also that reminds me to talk about it doesn't also refer to personal cleanliness,
Exactly.
right? Nobody is ever saying you should not wash with soap and water or you should not wash with Purell. Those kind of things are what's keeping our infection rate down in society. Even before COVID virus and after, those are the basics of keeping people healthy, living longer, and there's no question that those are critical.
Absolutely. So speaking of vaccines, we have a question. When a vaccine is available in the future, will it be a one-time event? Does it replace the regular flu vaccine taken in the fall/winter? So it's a great question. In fact, right now, we don't really know. We don't know if it's going to be one dose or multiple doses, if it has to be done once a year or every year. We do know it won't replace the flu shot. Just to clarify, the flu shot really protects you against the influenza virus, whereas this vaccine that we're looking to create is to protect you against this specific coronavirus. So that's just the clarification, but more than that, we don't really know. Everything's really in early trials right now.
Here's one. Why is there very little data on the statistics of people who have recovered from the coronavirus? Always so much data on cases. Is it people are not recovering or people aren't being retested? So that's a great question. Let's go to the numbers. So today we heard that there are 3,068 people who've recovered in Quebec. So that makes up about 18% of the cases. So what happened to the other 82%? Well, I think the person who was asking the question answered part of it. We're not doing any of the retesting. So that's part of the problem. By definition, in order to say you've recovered, you need 2 negative tests. So we're not doing that in Quebec, so that we don't know. And then just to step back a bit, we're not really doing mass scale testing anymore. The government about now, I'm gonna say 2 weeks ago almost, changed the prioritization. So we're not testing widely all Quebecers or those that are suspicious. We are focusing our testing on hospitals, CHSLDs, residences, nursing homes, healthcare workers, higher risk areas. So the numbers to start with are not as reliable, the number of cases to start with, and certainly that makes the number of recovered cases even less reliable.
Right. Good. So we thought we would take another mental health minute, and this time around we're going to focus a little bit on nutrition, some diet tips, and to try to consider during the quarantine. So I love that I've been seeing more and more people really kind of find their inner chef and cook now during the quarantine. For some reason, everyone's baking bread. I don't know. You can't find flour or yeast anywhere. But that's great. But I think it's a really good time to now assess your own diet and see if there's little things that you could tweak. So could you add more fruits and vegetables? Could we follow this year's Canada Food Guide that's saying, we should get more of our protein sources coming from vegetables, like vegetable-based protein sources. So beans, lentils, chickpeas, that kind of stuff in our diet. And really just look, there's so many healthy recipes out there. Maybe try a couple and see which one you'd like to make as a staple in your diet. Other things would be, if you're having any juices or sugary drinks, try to change those all to water.
I like those tips, Dr. Liello, like the feel-good foods, like we can eat healthy and you could feel good at the same time. And it's so easy to slip into bad habits too. So maybe some reminders are good now to try to always eat sitting at the table. A lot of us are working from home, so it's so easy to eat at your computer and get caught up in what you're doing and overeat. Maybe not eating straight out of the packet, because sometimes I might eat chips straight out of the bag, so that might be a problem. And if you feel full, it's okay to save the rest for later. So that reminds me of the island of Okinawa, where the Japanese have a saying of harahashibu. So harahashibu means eat until 80% full. And I think there's some lessons in there to learn, because they're one of the longest lived islands or people on the planet. They have a high density of people living into their hundreds and beyond. So I think that's a good saying for us to keep in mind.
Well said. Anyways, thank you and stay safe.
Be safe, everyone.